Hello, everyone, and welcome. My name is Kim Barnes-Peak, and I'll be your facilitator for this session today. I would like to start by gratefully acknowledging the territory that I'm joining you from. And I welcome you to think about the land that you're joining from, and also about your role in taking steps towards truth and reconciliation as I provide this introduction. So I'm joining today from the traditional, ancestral, unceded territory of the Syilx Okanagan Nation. As a fifth generation settler of Swedish and English descent, I have deep respect and gratitude to the Syilx people who have been stewards and protectors of the land since time immemorial. We know you may be joining us today from many places, either near and far, and we acknowledge the traditional owners and caretakers of those lands as well. Welcome to the 12th annual Okanagan Embrace Aging Month, and thank you again for joining us. Embrace Aging is co-hosted by Beem Credit Union, Interior Health, and the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan. Embrace Aging Month was launched 12 years ago to celebrate and raise awareness about positive aging, and has once again organized a number of educational opportunities and events during the month of March. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their family caregivers. Our goal is to inspire everyone to embrace aging, or to embrace positive aging. Closed captioning. So to turn closed captioning off, you can select the hide caption button on the menu bar. Questions. Please type questions or comments for the speaker into the chat box during the presentation. Questions will be read at the end of the presentation. And feedback for this event. Please complete the survey that will be emailed to you promptly following the event. So today's session is brought to you with the support of Embrace Aging Month and is titled Navigating Grief and Loss in Later Life. And our speaker is Ian Kunitski, Director of Programs and Services at Central Okanagan Hospice Association. Take it away, Ian.
Thank you, Kim, and good morning, everyone. I'm very happy to be here to do this presentation on navigating grief and loss in later life. As Kim mentioned, my name is Ian Kunitski. I'm the Director of Programs and Services with the Central Okanagan Hospice Association. I have been working with COHA, as we like to call our acronym, for about 3 years, but I have been working in hospice sector for about just a little over 10 years. My journey with hospice started as a child and youth coordinator working with children and youth who've experienced a loss through death, and later with adults as well. And later on to here, my role has changed a little bit. I've coordinate all the programs and services we have, and I thought just before we get started with our presentation, I would explain a little bit about who exactly COHA is and who we are not, because there is a little bit of confusion sometimes between Central Okanagan Hospice Association and the Central Okanagan Hospice House. So who we are not, Central Okanagan Hospice House or Kelowna Hospice House is located on Ethel Street. This is the building where there are 24 patient beds, and patients with a life-limiting illness go there and receive pain medications and comfort and care, so that they can live out the rest of their lives in comfort and peace as best as possible. This building is actually owned by Interior Health, and it's operated by Interior Health. They provide nursing staff and doctors and a medical team to support patients. The Central Okanagan Hospice Association does partner with Interior Health. We do provide support. We have staff member and volunteers who actually work out of Kelowna Hospice House, providing comfort and emotional support for patients and their families. But we do a lot more than that. So part of our organization or our programs and services includes community hospice visiting throughout the Central Okanagan. So we will visit patients who are palliative and their families in their homes at Kelowna General Hospital, in long-term care, and throughout the community. And we provide this whole person care, respite. We work with the caregivers, and we also do vigil services as well. We also have wellness programs where we work with anybody in the community, just to provide a little bit more comfort during yoga and mindfulness and Reiki. And what we're talking a little bit about today is our grief and bereavement program, which is our largest program of all the services that we have. So we provide adult services and children and youth services. And again, just to eliminate any confusion, we provide these services to anybody in the central Okanagan from Peach Sound all the way to Lake Country. So a common misconception is that you have to have somebody at Kelowna Hospice House or on the palliative program to receive our support, and that is not the case. We will provide anybody who has had a death um, recently or in the past, and any type of death, we'll provide grief and bereavement support for you. So, okay. A lot of our work is done through staff, through counselors, and we have a very large volunteer program. We have about 155 volunteers who are specially trained in working with both palliative clients and their families, as well as grief and bereavement. So that's a little bit about us. I hope that just kind of eliminates any confusion. And if there's any questions about that, again, I'm happy to answer those at the end of the presentation. Okay. So today we're talking a little bit about navigating grief and loss in later life. So today I'm going to just quickly define what grief actually is, so and as well as what mourning is. There's a little bit of a difference between the two. Both are equally important in the healing journey, and we'll just kind of give a brief definition of each. We'll go through a few of the types of grief that people might experience when they have a loss of a loved one through death. There are many, many different types, but we'll focus mainly on 5 that happen more commonly in later life. So and we'll also talk a little bit about life transitions and secondary losses, which is part of the grieving process and part of the healing journey as we move forward. So um, we'll talk about grief responses, how we feel in our mind, in our bodies, spiritually, socially, when a death happens in our life, what's sort of normal reactions and what isn't so normal. And then we'll go through some coping strategies and support. So, and then finally, we'll just end with a little bit about our grief and bereavement programs and services, and I'll open it up to any questions. So let's get started with what exactly grief is. So grief is when we're talking about the death of a loved one or a family member or a friend. Grief is the thoughts and feelings we experience after somebody dies. We call this an internal response to loss. So this is something that happens inside in our minds, in our hearts, in our stomachs, something that is internal. Thoughts and feelings might be sadness, anger, overwhelm, loneliness. We'll kind of go through a little bit of all that. So the important part about this is that grief is normal, it's natural, and something that I can't stress enough, it's something that we can't control. So a lot of times when clients come to us and they've got all these thoughts and feelings and they believe they're doing something wrong. So, I shouldn't be feeling angry. I shouldn't be feeling like this. These thoughts and feelings come to us. And they're different from everybody, but it's really important to understand we don't control these feelings. So these are these things that come into our mind. They're natural reactions to a death. Okay, it's unique for everyone. Another part that is sort of makes it difficult sometimes to have a treatment or a plan for working through grief is that everybody experiences grief uniquely. Okay. And then finally, for grief, there is no timeline, no order, and no end. Um, we don't, we say here we don't move on from grief. We always have grief with us. What we do is try and soften those feelings and those emotions, and we move forward with it. Okay. So mourning, on the other side of it, where grief is an internal response to a loss, mourning is the external response. So these are our expressions of the thoughts and feelings that we are experiencing and can't control after a loved one dies. So examples of mourning is when we talk with somebody, either personally or professional, about our loss, about what's happened, about some things we're feeling. Crying or an outward expression of emotion is mourning. We might journal where we go through all our thoughts and feelings, talk about the person who died, share memories, looking at photos, visiting the cemetery, etc., etc. So again, these are the things that we do when we have these grief feelings. we mourn and we express them externally. So this is the most important part of the healing journey, is the mourning, because without mourning, there can be no healing. This can There's no rush on this as well either. So when we do mourn, this can take time. So, and a lot of people need that time to process what they're feeling before they are ready to actually externalize these. So, grief will stay with us until we mourn. We've had clients who've come to us after 25 years, for example, who have had a death and they've just tried to push it down and push it down, and it kind of lays, dormant, and there's different feelings that come out. And then, you know what, something has triggered me. I need to kind of work through this. I need to actually mourn the death that I'm experiencing. Okay, so you might also, we might also hear the word bereavement from time to time. We talk about grief and bereavement. And bereavement is sort of a loose time period after a loss in which we've got when our grief is at the most intense and we start to mourn. So we call that a period of bereavement. So. I mentioned before, grief is not a one size fits all. There are many different types of grief, and we all experience it uniquely. So I'm going to talk quickly about the different types of grief that sort of commonly happen in a later life. Okay, so the first type of grief, it's labeled normal, and I have to be honest, I don't really like this label because I don't believe there's anything normal about grief. It is unique and it's experienced differently from everyone. This is sort of the terminology that they use, and they explain this as acute grief. So it's intense feelings. Especially at the beginning, we have these overpowering, overwhelming feelings of sadness, of anger, of overwhelm, of confusion. Um, but it's marked by movement towards acceptance of the loss and a gradual alleviation of the symptoms. So basically, we may feel stuck, especially at the beginning. We may feel like we are never going to get out of these intense feelings and out of this grief. But through time, and time is different for everybody, but through time, those symptoms tend to alleviate a little bit. They tend to soften, and that can be um, through your own work, through work with friends and family, and through work with a professional. So, okay. Um, when we're experiencing normal, what we call normal grief, we still have this ability to engage in basic daily activities. We can get up out of bed, we can dress ourselves, we can have breakfast or have lunch or have dinner. We can have a shower. We can go shopping. Basic daily activities that sort of need to be done. We're still able to do that even while we're grieving normally. So, okay. Um, the thing that's marked by any type of grief, and even a normal grief, is that this is permanent. So we will always grieve. And there are always going to be intense emotions that happen from time to time. We call these triggers. An anniversary that happens, every year kind of thing might trigger a big, intense emotional feeling. Holidays, Christmas or Easter is coming up, whatever you celebrate, these might trigger some intense feelings of grief. So even though we soften over time, at the hope anyway, we're still going to every once in a while get these big feelings of grief, and that will happen from now until forever. So, okay. Um, Again, no typical or average normal timeline. Everybody's grief is individual. So, some people might feel a little bit better after 3 months. Some people, it might take them 6 months. And some people, again, might go back and forth in between these feelings for a little bit of time. So, there's no timeline. There's no sayings that say after 5 days you should be feeling this, after 20 days you should be feeling this. It's different for everybody. Okay. The one type of grief that we do watch for and we're really careful about is what's called prolonged grief disorder or complicated grief. This is an entire webinar in itself, so I'm going to just quickly cover some brief points about prolonged grief. But this is the acute grief, like normal grief, but that persists over time. And in the psychology, the DSM Diagnostic Statistical Manual of Psychology, they sort of classify this as this acute grief that is 12 months or more after a death. And that is you're feeling these same intense feelings at the beginning and you just are not moving forward. This is what's called complicated grief. So some of these symptoms are feeling as though a part of oneself has died. Just still after 12 months, it's a disbelief that this death has happened. You're avoiding any reminders. And you're just in constant, intense emotional pain and difficulty moving forward with your life. Take these with, if you look at these symptoms, these are symptoms you probably, if any, after death, you will experience at the beginning. But if this is lasting for 12 months or more, you're probably in what's called prolonged grief disorder. And this is something where you need to seek, or where we would encourage you to seek professional support as quick as we can. And we can going to go through all of these symptoms and help you move forward. We don't want anybody to be stuck. Okay. Okay. Another type of grief that we see a lot, especially again in later life, is what's called cumulative. Okay, and this is when you experience a second or more loss while you're still grieving an initial loss. So, um, excuse me, you might have um, a loss of a friend, and then you're grieving that, and then a month later, somebody else dies. You hear somebody else dies, an acquaintance or another friend or a family member. As we age, as we get older, we tend to do see this a little bit more, where there's more than one loss occurring in our life. So, where this can become difficult is that we process grief from each loss a little bit differently. And if we are trying to process more than one loss at one time, and you might get this feeling of piling on and feeling overwhelmed. And I don't know how to feel because I want to grieve my spouse, but my best friend has also died. And how do I process and do these things differently? So you'll find yourself with a bit of mixed and uneven contradictory emotions, where we may be sad in one case and really angry about something else. So, okay. So, again, suffering from these multiple losses, it doesn't allow you to grieve for one specific loss at one time. So, okay. Ambiguous is a different type of grief. Ambiguous is something where you don't have a significant, or you can't really reach a closure or a clear understanding when somebody dies and you're either with them or you go to a funeral service or celebration of life. You might see the body, or you might have a chance to say goodbye. That gives a little bit of emotional closure. With ambiguous, we don't really have that. So there's two sort of types. Was one, as we call, what's called physically absent, but psychologically still present. Somebody who is missing or presumed drowned, where they haven't recovered a body. That is what's called ambiguous, because we don't really have that sense of closure. In the case at later life, what we see a lot of is where somebody is physically present, but psychologically absent. So somebody with dementia or Alzheimer's, who loses their memory, and their personality changes a little bit. You can see that person in front of you and you can talk to them, but psychologically they're already gone. So this is sort of an ambiguous grief, where we are experiencing these grieving feelings with somebody who is still actually alive. Okay. A little quote here that I found is, ambiguous loss can feel deep and as wide as the ocean, and it's endured in silence by millions. We don't like to talk about these feelings of grief when we're still caring for somebody, or when somebody is still alive. So we sort of what we call suffer in silence. Okay. And a little bit um, familiar, or a little bit sort of similar to that ambiguous loss when we're talking about Alzheimer's and dementia, is what we call anticipatory grief. And this is a grief where we're actually experiencing grief as if that person has already died, but they are still alive. So usually happens with somebody with an illness, with a terminal diagnosis, or somebody living with cancer, when they've been given a prognosis or a timeline, and there's no cure. We still care for them. That person is still alive, but we start to experience and we start to think about what life is going to be like without them while they are still alive. Again, very natural, very normal. But what happens with this is we often get these feelings of guilt and shame because we are thinking that way. So again, if I can go back to that very first slide with the definition of grief, this is thoughts and feelings that we can't control. So really important if we're experiencing this to talk that through with somebody and know that this is really very normal reactions. Okay. Okay. Um, to complicate our grief a little bit, what we see in later life is there's all many different factors as well that are involved, and this might affect the grieving process as we move forward when someone dies. And the first part is what's called life transitions. It happens throughout our life. It's just major changes in our life that could possibly cause some stress or upset. Um, Again, happens throughout our life, but we do see it even more as we age and as we get older. Retirement, for example, is a transition that is a big change in our life. Role changes. This is something you see often between parent and child, where those kind of roles might reverse a little bit, where as a parent, we've always taken care of our children, but as we age, we may need some help as well, and that child sort of takes care of us a little bit. So we often see relocation. We go from a large family home into a condo or perhaps long-term care or assisted living. Um, Loss of health, loss of mobility, hearing and vision, and loss of driver's license can be a very stressful event in our life. So as we are trying to cope with and adapt to these changes, a death in our life can just add to that little bit of stress and upset. Okay. Okay. And along the same lines, we also have when we have grief, when we have a death, we have what's called a secondary loss. And secondary losses are sort of the consequences or of a primary loss. Of we think about grief and we think about a loss and we think about the death of a person. But there's also losses that come along with that death. So loss of identity, for example, in the case of perhaps a married couple who've been married for 50 years, who have always been Mr. and Mrs. Jones. Mr. Jones dies, and now we lose that identity as a couple. We're now just Mrs. Jones' widow. Um, we might have some financial security again. We see that a lot in couples and older couples where one of the spouses or partners dies. There might be some financial challenges or financial worries. um, Loss of a home or community. We might have to move again if we're in a house and one person dies. We might have to move. So dreams and future plans is another secondary loss. So um, I know I can share when my dad died many years ago. He had just very recently retired, and my mom and dad had many plans to go on a worldwide trip, and they were going to go travel the world together and do all these things. And then he died suddenly, and those dreams and future plans were suddenly gone. So that's an example of a secondary loss. So, and then you can find yourself losing, especially at the beginning, just this sense of purpose. Okay. So as far as grief, grief affects us in so many different ways, and it can be difficult to understand. It can be difficult to sort of comprehend some of these things that we are going through and relate them to the actual grief that we're going through. So we've talked a lot about feelings and thoughts, things that we can't control. Some of those feelings are sadness, anger, guilt. We might feel anxiety, numbness, yearning. The bottom one there says relief, and that is sort of a difficult one to really understand. But if we're watching somebody, a loved one, suffer and go through all these pain and difficulties as they go through a difficult illness, for example, we might just get that sense of relief that they're not suffering anymore. It's a difficult one to sort of take in. But again, something we can't control and something very normal. So, but there's also some behaviors and physical responses that come along with grief. Sleep is a main one. Sometimes we sleep too much. Sometimes we can't sleep at all. And appetite is another one. We may not want to eat. Um, but there's absent-minded behavior that happens a lot. Our brains are very full with grief. When we have grief, it can be at the beginning, especially, it can be very all-consuming. And sometimes we don't understand when we are grieving why we lose our keys 4 times a week, for example, or we can't find them. Um, why we can have a conversation with somebody and we're talking and we think we're engaged, and 30 seconds later we forget what we talked about. So it's very normal. Again, our brains are very full, and this can be difficult to understand, and we can end up sort of, getting angry with ourselves and chastising ourselves for not being with it, sort of thing. Um, we also have a lot of physical responses to grief, just general muscle pain. We could get headaches, dry mouth, stomach pain, restlessness. Some people get chest pain and difficulty breathing, a normal response to grief, something we don't really think about when these things are going through. So, and of course, if somebody dies, we often, look to our spiritual self and think about questions about, wondering what meaning of life is. If you have a faith, maybe doubting that faith or questioning some of the beliefs that you've had throughout your life. So this can be especially true when somebody is diagnosed with an illness when they might be completely healthy or nothing wrong, and all of a sudden this big change happens. We kind of question what is going on and what's the meaning of life. So, okay. And then as far as social behaviors go, very normal. Especially at the beginning, we sometimes withdraw from our social situations. People will invite us out and we don't want to go. We have no energy to initiate contact with friends or with family even. So, and we get these feelings of isolation and loneliness. So this is what grief does to us. It's difficult. It is very challenging, and I'm kind of talking through all this a little bit just because I want everybody to understand a little bit that grief is hard. It's very, very difficult work, and we may think that we can get a handle on it, but there is a lot to process with everything that is going on in our life, especially in later years. Okay. So I love this picture. This is a statue that somebody created, and they called it grief. So, and this is on a bench. But one of my favorite saying is, "Grief is the form that love takes after someone dies." So, um, without love, we won't grieve. But without grief, it means we've never loved. So, if you can remember that, love is just a form. Grief happens. So, okay. So let's move on. And I'm being aware of the time. I apologize if I'm talking very quickly. There's a little bit to cover here, but I want to talk about some of the support and some of the coping strategies that we can use when we're grieving. So first of all, again, I want to just sort of introduce you to Lily. Lily is a fictitious client right now, but she has come in. She is 80 years old, widowed just last month. And, a little bit about Lily. She's been married 48 years and her husband died after a 2-year battle with cancer. So Lily phones in. She says, "I'm thinking about my husband constantly. I'm having a hard time sleeping. I'm really tired, feeling lonely. I can't stop crying. And I've gone to the senior center every week for 5 years. I have stopped going. Um, yeah, I can still shop for groceries and I can cook my meals, but I do find it difficult to eat." So, okay. A little bit more. Lily's driver's license was taken away last year because of her vision problems. She does have some minor health problems of her own. And she lives in a condo she and her husband have shared for the past 15 years. But the husband was responsible for her finances, for paying the bills, etc. Her support system, she does have a daughter and son-in-law who live in Kelowna, and they've been very supportive for her since her husband died. She has many friends, but a few have died over the past few years. She has a son and daughter-in-law and 2 grandkids who live in a big house in Ontario, and they would like Lily to actually come and live with them so they can help support her. Okay. So when we see somebody like this as a client comes through, we look at and sort of kind of take a little bit of an assessment of what Lily's grief looks like. And again, remembering that everybody's just a little bit different. So, um, Because Lily's husband had an illness for 2 years, we might suspect or we might ask if she's had a little bit of anticipatory grief leading up to the loss, meaning she's probably thought a little bit about what her life is like, will be like when her husband dies, and even when he is still going through his illness. So, um, at this point, we are going to assess this as normal grief. She's got very intense emotions. Again, crying a lot, thinking about her husband, can't eat, can't sleep, very normal reactions to grief. But as she mentioned, she can still get up out of bed and go to the grocery store and cook her meals. So she's still got that a little bit of ability to function. Um, just backing up a little bit with that normal grief, if she had called and it had been over 12 months, we might look at prolonged grief disorder or complicated grief. But for now, we're going to assess this as normal grief. There is some cumulative grief that she has mentioned. So a few friends have died. At this point, though, we're going to focus mainly on her spouse, the spousal loss, the loss of her husband. That seems to be the most prevalent. Okay. And I don't know if you caught a little bit, we mentioned there are some life transitions and secondary losses that she's actually also going through that might just impede or add to the stress of the grief that she's experiencing. So she's lost her driver's license, some dreams in future, lots of identity, and there is that role change. If you recall, the son-in-law living in Ontario would like to come so that he can take care of her, which is a big role change in her life. So, okay. So as we work with Lily, we will probably, there's a few different approaches, but the first things we would talk about a little bit is some of the coping strategies that she can do on her own or with the help and support of her friends and with her family. So the very first one is it sounds simple, but it actually is a difficult one, and that is just to simply accept, acknowledge, and validate all those feelings that she is having. Um, Intense sadness, thinking about her husband, anger, worry, fear, overwhelm. Again, if I can go back to that definition of grief, thoughts and feelings that we have when someone dies, normal and something that we can't control. So when we start to say, I shouldn't feel angry or I shouldn't be worried because I know I'm going to be taken care of, or I shouldn't be sad. We've had this beautiful marriage for 48 years and I should be happy that we have that. Take the shoulds out of it. This is very normal, and just accept, you know what, I'm feeling hurt. I'm feeling a lot of emotion, and I know that is a normal behavior. So we'll stress and emphasize to make sure that you accept these feelings. Okay. Um, with those feelings, we will work a little bit on the mourning process. This is that external response. This is getting those feelings from the inside and getting them out of our body. So, and we'll do that in what we call a healthy way. So, healthy ways of expressing feelings are talking to someone, crying. We might try journaling, painting, or music. And another way we express feelings is just to review and reflect on memories, both pleasant and unpleasant. Especially at the beginning, it can be a little bit difficult to think back to some of the happy memories or some of the pleasant memories that we have. A lot of times, I know going through loved ones with an illness at the very beginning, it's difficult not to get that image of somebody in the dying process out of your mind, and it's an unpleasant memory, and it's okay just to review and reflect that and think about that. And that with that, try and reflect, go back in life and think about some of those pleasant memories too. So these are all mourning and external expressions that will help you in your healing process. Okay. A really probably the most important part of any type of grieving strategy or processing is to reach out and or accept help from your support network. Some days we don't feel like it, and that's okay. Some days we want to just be alone. We don't want to talk to anybody. We don't want to go out. There's nothing wrong with that. It's just we don't want to make that become part of our lifestyle where we're just isolating ourselves over time and all the time. So friends, family, your doctor, if you're having trouble sleeping or having trouble eating, there's a lot of community resources, but if you can have that support network, it'll really help you along in that grieving journey. So, um, one of the things I wanted to talk about support systems is it's a really common happening or circumstance where people expect one person in their life to sort of support them and be everything to them, and that's not always the case. Sometimes the person that we think is going to help us the most doesn't necessarily help us in ways that we hope or expect them to. But that doesn't mean they might not be sort of useful or part of your healing journey. So we always kind of stress to maybe have a support system in place if you can, with a group of people and who will help you with different needs. So sometimes we might just want to distract ourselves and need to go out, for example, and forget about everything and just have a night out. And we might have friends or family who can help us with that. Those same friends and family might not be the ones who will help us when we just need a shoulder to cry on or just need to vent our anger. There might be somebody else there. So keeping that in mind with your support network and with the people that are in your life, remember that there are people who will be helpful for different things depending on your needs. Okay. The other part of coping strategy, and this is not always an easy thing to do, and especially at a later life, but we do encourage you to postpone major decisions if you can. That might not always be the case. If you're, a husband and wife or partners living in a big house and one dies and you can't afford that, then there's no choice that you may have to move or sell that house. But if you can postpone those major decisions sort of as long as you can, we recommend about 6 months minimum. It would be really helpful because you're already dealing with a lot of overwhelm and major decisions add to that stress. So if you recall in Lily's case, her son very lovingly and very compassionately would like Lily to come and live with them so they can take care of them. That would be a big uproot in Lily's life to move from the central Okanagan all the way to Ontario so soon after her husband's death. So that might be something that Lily might consider in the future, but for now, let's cope with the work on the grieving and the feelings I'm going now. I've got support in place already. So maybe it's a conversation with her son saying, thank you so much. Let's look at that in about 6 months' time and we'll give it some thought. Okay. Um, the other part of a coping strategy, and again, it sounds simple but very difficult, is just to practice deep caring, but just to be nice to yourself, to sort of recognize that this is really difficult and really hard work when you're grieving, and getting frustrated with yourself or getting angry with yourself for things that you're doing or not doing or things that you're feeling you should be further ahead than what you are is not helpful. So just a reminder to step back and just very simple deep breaths and say, you know what, this is really difficult. This is a difficult time. I'm doing the best that I can. So, okay. Sleep or rest where you can. I did mention that sometimes sleeping can be difficult. Um, so we kind of encourage just sleeping or resting when you can. So if you normally go to bed at 10 p.m. and are up at 6 a.m. and you can't sleep at night, that's okay. That's very normal. Your brain is full. But if you feel like if you're exhausted, it's okay to lie down and have a nap at 11 a.m. or 1 p.m. or just to rest yourself like that. So rest is really important when you're trying to heal. So and then same goes with eating as well too. It can be difficult to eat. We don't want to eat. So if you can just, tell yourself even just a couple of bites of a healthy meal here and there is really going to help you as you move forward. And then finally, this is not for everybody, but it is something, of course, that we do is just to seek professional support. So a grief group, it can do wonders for some people. It's not for everybody, but a lot of people find a lot of benefit and a lot of help in being in a group with others who are going through similar experiences. Everyone's experience is different, but people who have had a loss and who just sort of get it. So when you come in and say, this is what I'm feeling, that people in the group will understand what you're talking about and they connect. So a grief group can be very good for connecting with others who are experiencing, who sort of understand some of the things that you're going through. And then finally, counseling too can be helpful for a lot of people. And that is just listening, being able to talk to somebody who will listen in a non-judgmental way, and who will just offer those strategies and some skills that you can use as you're moving forward. So, okay. Um, I'm going to very, very briefly go over this with professional support. If you're talking through counseling and through grief groups, some of the things that we look at when people are grieving is how they're coping every day to day. And so one of the theories that we've come up in counseling is what's called a dual process theory. And this sort of theory states that we have two different types of stressors and two different types of work that we have to do while we are grieving. And one is to sort of sit with your grief, and this is called loss oriented. And that is where we're sitting with our grief. We're thinking about our loved one. We are missing our old life. We are focusing on all this pain that we are experiencing right now. And then the other one is called restoration oriented. And this again can be stressful because this is where we're trying to develop a new life and a life without that loved one in ourselves. So we're doing new things, trying to form new relationships and make new friends and adjusting to different how life is different. So sometimes people get caught being stuck in one or the other. Sometimes they will just sit in a loss oriented stressor where we're just thinking about and doing that grief work. And others want to distract themselves and they don't want to think about that pain. They just want to figure out and move forward and be trying to create this new life ahead of them. So being stuck in one or the other can be damaging and it can delay the healing journey. So when we're looking at professional support, our counselors will try to work through what's called this back and forth process or an oscillation where we are spending a little bit of time developing a new life and a little bit of time sitting with our grief and focusing on that pain and how we're going to work through it. So, okay. And then the other part of our healing journey is what's called continuing bonds. And this is something that we stress it's very normal and very healthy to continue your bond with a deceased person. This is somebody that you've loved and shared a life with and experiences. Um, and we don't ever forget them, and they don't actually ever leave our lives, and they don't ever leave our hearts. So, part of moving forward and developing a new life is bringing our loved one with us and making sure that they're still with us in mind and in our hearts, sort of thing. So we're learning to adapt and honor that memory. So when we do that by just creating different things that we connect with that person. So whether that be making a memory box or finding a place where we can visit and talk with our person, every time we share a memory, we continue that bond together. We talk about their life and review their life, and we pass that memory on to others as well, so that our loved one is never left behind and continues with us. Okay. Um, I'm looking at the time here. I'm going to skip. I'm going to go through this very quick because I think we've probably understood a little bit as we've talked. Some expectations you can have. It'll take longer than most people think it should. There's no timeline. So if anybody says it's a month or 3 months, you should be over it. Punch them in the nose. Well, don't punch them in the nose. I'm just joking. But tell yourself grief takes as long as it takes, and it takes as long as you work through it. So it takes a lot of energy. Grief takes a lot of energy. You're going to grieve with many things. We talked about those secondary losses. It's going to involve many different feelings and reactions. Some we expect, some we don't. And grief is going to play with our mind. So it's going to consume us where we're going to have trouble thinking and making decisions. Poor memory, organization, and poor concentration is very common when we're grieving. Okay. Sometimes we'll feel like we're going crazy. We're not. Mhm. And then we talked about all those different reactions that we're going to have. Grief is more than just thoughts and feelings. Okay. So, Koha has a number of adult grief and bereavement programs and supports. We talked a little bit about how, support through family and friends is very important. But if you're looking to connect professionally or with peers or with others who are grieving, we have a number of different programs available throughout the year. It is for anybody in the central Okanagan from Peachland all the way to Lake Country. And again, there is no you don't have to be tied to Kelowna Hospice House. You don't have to have somebody who has been on the palliative program. Anybody who's experienced a death or a loss, no matter what time it was or who it was, can call us for support. So we have one-to-one counselors. We have about 6 different counselors that will work with you. We provide up to 8 sessions with a counselor that will work with you. They'll listen to your story, hear your story, and give you the skills and strategies to move forward through your grief. So we also, I mentioned our volunteer program. There's 155 volunteers. A good section, a good part of those volunteers are trained in grief and bereavement support. Now, they are not counselors, but they're happy to come and meet with anybody if you want to go for a walk and talk about your loved one, or meet for coffee and just talk about some of your feelings. We have volunteer support available for that throughout the community. So, and then we have a number of adult grief groups. Our grief groups are what's called closed groups, meaning that you start and finish with the same people or same participants. So these are 8-week groups. We run them about 4 times a year, and all of our groups are specified towards a type of loss. So we have a spousal loss group for somebody who has lost a husband, wife, or partner. Everybody in that group is going through that same experience. So we also have what's called a traumatic loss. So anybody experiencing a sudden death through maybe a homicide, suicide, drug overdose, or an accident. It's participants all experiencing that same type of loss in one group. And we have a parent and sibling loss group as well. So everybody in that group has lost either a parent or a sibling. And then we have what's called a bereaved parent loss group, anybody who has lost a child. Again, that's a different type of loss. So we have participants, all the participants in that group, same type of loss. Again, anybody can register for one of these groups, and I will go through the referral process in just 2 minutes. But it's a very popular program that we have, and most find it very beneficial. So we also have walking groups. These are sort of lighter groups. We run these once a week. This is our only drop-in group. We have a group in Kelowna and West Kelowna, and participants meet once a week if they're able to go for a very leisurely stroll along the Mission Greenway in Kelowna and along the Galatly Bay water in West Kelowna, and then usually meet for coffee afterwards. So most of the participants in our walking group have been through one of our other programs first, but that is not a requirement. So. And then I mentioned earlier, we do some wellness programs in conjunction with all of our programs. We offer Reiki, yoga, and some meditation and mindfulness workshops. And at our office on Cooper Road here, we have a library of books and resources that anybody in the community is welcome to come in and have a look and sign out at no cost. So all of our programs are at no cost to the client. We don't get funding through the federal government, but we do have very generous donors in the community, as well as some grants and fundraising activities that we do. So we're able to provide these programs at no cost. The referral process is very simple. You can phone in, ask to speak. Right now, Andy Harvey she is our bereavement services coordinator. If you phone in and just ask for grief, you're looking for grief and bereavement support, they will put you through to Andy or whoever is available, and you will do a brief or not so brief intake over the phone, where we just ask a series of questions about your loss, some of the feelings and emotions and things and challenges that you're going through. And based on that conversation, we will recommend either a counselor or a specific program for you. Thank you for listening to me talk. I know I rushed through that. There's a lot of information to get through, but I appreciate this being able to tell you a little bit about what grief and mourning and loss look like and some of the coping strategies. And I'm happy to answer any questions that we have coming through right now.
Thanks so much, Ian, for all of that. That's such great information. And please feel free, those that are attending, to type your questions into the chat, and I'll be sure to forward them on to Ian. In the meantime, while we're waiting for a question or a comment to come through, I wondered about resources or programs that are specific to cultural needs that might exist in the community, and if there's ways that COHA is supporting that process.
Yeah, and it's a great question, and it's something anybody can call in and ask for services regardless of age, of gender, of race, ethnicity, and we do our very, very best to make sure that we're aware and educate ourselves first of the cultural practices around death and dying and grieving, before we will go ahead with that support sort of thing. And it's one of our focuses this year. Actually, part of our strategic plan is to focus more and educate ourselves more on EDI work and inclusion in our community, because we want to make sure that we are doing things right for everybody. So, um, as an example, I can share we have just recently worked with a family who've experienced loss, and there was a language barrier, so we've actually brought in a translator to work with us and this family to make sure that we're able to offer that support. So, yeah, thanks, Kim.
Lovely.
Hmm.
And we're getting some questions populated through.
Okay.
So the first one is, how many Reiki sessions are available?
How many Reiki sessions? So,
Reiki, pardon.
yeah. So it's a good question. So we offer 6 Reiki sessions. It's a very, very popular program. So and we, at the office here, we run it on Tuesdays and Thursdays, and so there's 6 Reiki sessions you can have up to no cost, and then afterwards you're put on sort of a cancellation and wait list, meaning that if there's a last minute cancellation, we will and you're free, we will call and you can come in. So it's 6. Most people tend to have a few more than 6. Mhm.
Yeah.
Mhm.
And next question, are there similar services south of Peachland that you're aware of?
I know Penticton hospice covers they cover some, south of Peachland up to Penticton. They have a hospice. I don't think they have quite the extensive programs that we offer. And I think that's probably just a matter of population. Um, but there is a Penticton hospice, and I know they do have grief and bereavement programs available. Mhm.
Um, you talked a little bit about thinking from the personal perspective. So
Mhm.
thinking of if, for example, if I'm the one going through the grief process, but let's say for someone to support, so a caregiver to be able to support someone that's experiencing that,
Mhm.
how could they best navigate that to say access supports and services that COHA offers, or that kind of thing? Like how could you best support a loved one through this process?
Yeah, and we do have that part of our programs and services is working with caregivers and offering caregiver support as they're going, as they're going through this difficult journey. And there's a lot of different factors involved. I've mentioned the anticipatory grief that somebody experiences, but there's just also caregiver burnout. It's very difficult to be available and to care for a loved one as much as we'd love to do it, sort of thing. So we offer through our volunteers and through staff some respite. A little bit of volunteers will come and sit with a loved one just to give somebody a bit of a break, just to go out and get some fresh air or to support. But we do offer that caregiver support, where if somebody needs somebody to talk to, and to support them as they're going through this journey, um, that's available. The same thing, if just phone our office and make a referral, and we can get that set up for you.
It's really cool.
Hmm.
And you spiked a thought process in my brain, which is that
Hmm.
anticipatory grief.
Hmm.
So when I was listening to the presentation and reading the slides, I was hearing you know a seeming focus on when the loved one passes away, but we've noted that anticipatory grief happens well before that process
Hmm.
occurs.
Hmm.
Are there services and supports available for anticipatory grief before a loved one passes on?
Yeah, there are. So we have counseling services available for anticipatory grief. We don't have a group. That's one we've tried kind of in the past, like a drop-in caregiver support group, and it's sort of, there's a few um, kinks to work out first. But we do have anticipatory grief services available for counseling. So anybody who has a loved one who is on the palliative program can phone in and work with one of our counselors. And uh, the one difference with the anticipatory grief with counseling, With regular grief counseling, we offer up to 8 sessions at no cost. With anticipatory, there's really not a sort of a session limit.
Mm,
Yeah. Hmm.
lovely as well to
Yeah.
hear.
Yeah.
That's, yeah, I would imagine that that would be very supportive. So I
Yeah.
love.
Yeah.
And speaking of supportive, so the support groups, you mentioned the walking group, which is really great. What can one anticipate to see in a support group? What would that look like?
Okay, in a grief support group you're talking
Yeah,
about? Yeah. So,
yeah.
so as I said, it's 8 sessions, and so every session we sort of try to move forward and build on the session before. That doesn't always happen because it's a chance for people to talk about what they're going through, and to get not necessarily advice from other participants, but just sort of a general support. So quite often we'll have a topic. We might talk about major decisions, for example, as I mentioned before. So we might talk about how that might look and how difficult that can be. And then somebody might bring up something, and we'll go down a different journey. So the group is led by facilitators, but they're not counselors. They facilitate, they sort of, their job is to lead, but to make sure that conversations go where participants want it to go. And I think what you can expect in a grief group, what I see and what I love to see actually is, because I keep a close eye week 1 and probably week 2, when people come in, it's it takes a lot of courage to come in and into a room full of strangers that you don't know and talk about something so personal. So week 1 and week 2, you usually see a little bit of hesitancy and a little bit of nervousness, very, very natural, of course. When the group ends, people will go right out the door and on to the thing and come back. And as it sort of progresses between week 1 and 2, you start to see bonds form with all the participants. And so, week 3 and week 4, you may be walking out the door with 2 or 3 participants who are in the group and talking or sharing phone numbers and discussing, maybe we can meet for coffee, kind of thing. And usually, and that will continue to grow, so that by week 7 or 8, and even 6, there's a little bit more laughter in the room. When people are coming out, they're hugging, they're talking with each other, they're sharing personal, they're making plans as a group or maybe as an individual. So a lot of really good connections happen in our grief groups, and that's sort of the thing that I love to see. Mhm.
Another question that's come through, which is a statement and a question. So thank you for your
Mhm.
presentation.
Mhm.
Can people who live south of Peachland reach out to Koha and the supportive programs that you offer?
It's a good question, and unfortunately, we are sort of bound by the limits of central Okanagan, so Peachland, through to Lake Country. You need to reside in those things, and so if you are south of Peachland, I do encourage you. The Penticton Hospice can help. So, yeah. Hmm.
Thank you. And
Hmm.
noting the time, is there anything that you'd like to share to to summarize, or last minute words of wisdom to share with the group before we move
I have one little story I'd love to end with. It's one of my favorite stories, and I don't, it's sort of internet lore that this came on the internet on a group. I don't know whether that's true or not, but I do love this story, it's titled "The Old Man and Grief." So if I can share that to finish, that would be wonderful, Kim. So,
on? Please
okay.
do.
So the story, it starts with somebody on an internet group wrote this heartfelt plea. My friend just died and I don't know what to do. And they got a reply from this person here, and this is what he said. So he said, "All right, here goes. I'm old. And what that means is I've survived so far, and a lot of people I've known and loved did not. I've lost friends, best friends, acquaintances, coworkers, grandparents, mom, relative, teachers, mentors, students, neighbors, spouse, and a host of other folks. Here's my 2 cents. I wish I could say you get used to people dying, but I never did, and I don't want to. It tears a hole through me every time somebody I love dies, no matter the circumstances. But I don't want it to not matter. I don't want it to be something that just passes. My scars are a testament to the love and the relationship that I had for and with that person. And if the scar is deep, so is the love. Scars are a testament to life. Scars are a testament that I can love deeply and live deeply and be cut or even gouged, and that I can heal and continue to live and continue to love. As for grief, you'll find it comes in waves. When the ship is first wrecked, you're drowning with wreckage all around you. Everything floating around you reminds you of the beauty and the magnificence of the ship that was and is no more. And all you can do is float. You find some piece of the wreckage and you hang on for a while. Maybe it's some physical thing, maybe it's a happy memory or a photograph. But for a while, all you can do is float and try to stay alive. In the beginning, the waves are 100 feet tall and crash all over you without mercy. They come 10 seconds apart and don't even give you time to catch your breath. All you can do is hang on and float. After a while, maybe weeks, maybe months, you'll find the waves are still 100 feet tall, but they come further apart. And when they come, they still crash all over you and wipe you out. But in between, you can breathe and you can function. You never know what's going to trigger the grief. It might be a song, a picture, a street intersection, the smell of a cup of coffee. It can be just about anything, and the waves come crashing. But in between waves, there is life. And somewhere down the line, and it's different for everybody, you find that the waves are only 80 feet tall or 50 feet tall. And while they still come, they come further apart. You can see them coming, an anniversary, a birthday, or a holiday. You can see it coming for the most part and prepare yourself. And when it washes over you, you know that somehow you will again come out the other side. Soaking wet, sputtering, still hanging on to some tiny piece of the wreckage, but you'll come out. And take it from an old guy, the waves never stop coming, and somehow you don't really want them to. But you'll learn, you'll survive them, and other waves will come, and you'll survive them too. And if you're lucky, you'll have lots of scars from lots of loves. Mhm.
Thank you so much, Ian. I think that was a beautiful way to finish up the session today.
Okay.
And I
Mhm.
sincerely appreciate it. Stories are what make us, and I appreciate that story being shared.
Yeah, thank you.
So we'd like to thank you, Ian, for presenting today, and for everyone that attended the webinar. We encourage you to attend other events scheduled for the rest of this week with Embrace Aging, and you can see those on the website okanaganembraceaging.com and register there if you haven't already. We look forward to growing this event in the Okanagan and beyond, and encourage anyone interested in supporting Embrace Aging in the future to please contact us. The contact information is available on the website. And you'll receive an email with a link to complete an online evaluation form after we close out. We welcome everyone's feedback and suggestions for planning Embrace Aging events in the future. And we have much gratitude to Ian and for all those that joined, and for Jaquetta that provided the seamless tech support in the background. Thank you so much, and take good care. Until we meet again.
Take care, everyone.
Bye-bye.
Bye.